Hi everyone, my name is Vaishali Mehta, and I will be presenting along with Ilana Porges and Caitlin Demarest. We are all fourth-year medical students at Sidney Kimmel Medical College, and will be presenting our research project that was carried out in Kigali, Rwanda, in collaboration with students and faculty at the University of Rwanda and Sayashka, a referral hospital in Kigali. Our project is titled Management of Obstetric Patients with Non-Communicable Diseases in Kigali, Rwanda, a Descriptive Analysis.
Non-communicable diseases, or NCDs, are a significant risk factor for maternal morbidity and mortality, of which lower-income countries carry a disproportionate burden of disease. At Sayashka, a tertiary care hospital in Kigali, Rwanda, physicians have observed a high incidence of delays in the obstetric care of women with high-risk pregnancies. Our research project aimed to assess and describe the obstetric care of women with NCDs at Sayashka, as well as characterize some of the risk factors for adverse outcomes among women receiving care at the hospital. For the quantitative component of our project, we completed a retrospective chart review of 261 patients receiving obstetric care for elevated blood pressure or blood sugar at Sayashka between June 2016 and July 2019, and analyzed a compilation of the de-identified data. We also performed a qualitative analysis, which consisted of 7 interviews with patients at Sayashka. Interviews were conducted in Kinyarwanda and transcribed and translated into English. These interviews were coded and analyzed using NVivo.
We have thus far looked into a number of variables to characterize the patients included in the chart review. We documented the systolic and diastolic blood pressures measured upon admission to Sayashka. The mean systolic blood pressure was 155 and diastolic blood pressure was 100, meeting criteria for hypertension. We suspected that elevated blood pressure and blood sugar may be a recurring issue for many of the patients included in this study. In fact, 22.2% of patients were diagnosed with an NCD in a prior pregnancy, the most common of which was preeclampsia. For their current pregnancies, the majority of patients were admitted to Sayashka for preeclampsia or other blood pressure-related conditions, followed by fetal health concerns such as non-reassuring fetal status or oligohydramnios. The most common presenting chief complaints on initial contact with the healthcare system were headache, epigastric pain, and routine antenatal care visits. Analysis of the qualitative data identified 10 themes. Among these were knowledge, accessibility, and health behaviors. There was a general lack of knowledge among patients in regards to their diagnosis and treatment. The consensus among patients was that care is accessible despite long travel times to healthcare facilities. Health behaviors during pregnancy were deemed neutral in terms of high starch content in diets and positive in terms of physical activity in 5 out of 7 patients. Our results indicate that many patients had uncontrolled hypertension during their pregnancies. The most common presenting complaints and reasons for admission were related to hypertension and preeclampsia. It was also common for patients to present with non-reassuring fetal status and other complications of elevated blood pressure and blood sugar during pregnancy. Over 1/5 of patients were diagnosed with NCDs in a prior pregnancy as well. This indicates that there is a gap in management of these conditions, leading to adverse outcomes. Our qualitative data through interviews have elucidated the need for a stronger emphasis on health education and literacy, as well as improved patient-provider communication. Although our analysis is still ongoing, we observed in the course of our research that a significant number of pregnant women with diagnoses of non-communicable diseases experience delays in care, despite previous diagnoses indicating a high-risk pregnancy. The Rwandan public health care system uses a tiered or pipeline referral process. Patients must first present to a health center, then get referred to a district hospital, and finally to a tertiary care center like Sayashka. This process can increase efficiency of healthcare and decrease expenditures, but also unfortunately lends itself to delays in care for many patients who may not have adequate access or transportation to large health centers. Another factor we identified is insufficient recognition of high-risk cases. Many of these patients presented at health centers in remote villages and were not adequately referred based on their symptoms, therefore presenting late in their pregnancy to a tertiary health center. Furthermore, another significant issue we noticed was inadequate follow-up protocol and discharge instructions. Patients who should have been counseled to promptly return for follow-up appointments and continue medications for a specified amount of time were often not told to do so based on documentation. Finally, most health records at Sayashka are paper charts with extremely limited information on a newly established online EMR system. Most charts were adequately documented, but many lacked vital information. Our project originally intended to collect postpartum data for our patients, but we were unable to do so as there is minimal outpatient documentation at Sayashka. Future directions for our research include a geographical analysis of the most commonly utilized health centers and the inclusion of other district hospitals and tertiary centers in order to expand the generalizability of our findings, ultimately with the goal of assessing the need for implementation of a more streamlined referral process for patients with high-risk pregnancies.
Our data collection was limited by handwritten documentation in the hospital in terms of legibility and completeness. Technical challenges, including access to the newly established EMR system, recording devices for interviews, and internet access, also posed obstacles to research. Language and cultural barriers impacted the ethics approval and archives access processes, as well as recording data from charts written in Kinyarwanda and French. We must also acknowledge that there are inherent ethical concerns in all global health research. Despite the impetus for this project coming from Rwandan physicians and our partnership with Rwandan medical students and faculty, we acknowledge that we have gathered and interpreted data in a context unfamiliar to us, with the goal of making recommendations to improve health outcomes. We must heavily rely on our partners in Rwanda for further interpretation, especially when making recommendations, to ensure that they are appropriate, relevant, and feasible.
We would like to acknowledge Dr. Irakoze, Dr. Short, Dr. Plum, and Dr. McIntyre, who all provided valuable feedback and support. Thank you all so much for your attention.